Hello, I'm Professor Nick Francis and I'm the Chief Investigator of the COAT study. In this video, I want to tell you a little bit more about the study to help you make up your mind whether you'd like to take part or not. There's also information sheets on our study website, including full and brief participant information sheets, and you can talk to your healthcare professional about the study as well. It's important to bear in mind you don't have to take part, and if you do decide to take part, you can always change your mind, and there's no consequences to that. So what's the study about? Well, the study aims to test whether 5 days of antibiotics for cellulitis works as well as 7 days. Cellulitis is a deep skin infection that commonly affects the legs and is usually treated with antibiotics. Most cellulitis is treated in the primary care setting, and most primary healthcare professionals will treat it with a 7-day course of the antibiotic called flucloxacillin taken by mouth. But scientific studies are increasingly showing that shorter courses of antibiotics work just as well as longer courses for a range of infections, and this appears to be true for cellulitis. There have been studies of patients who have been treated in hospital with more severe cellulitis, and they seem to suggest that those who take a shorter course of antibiotics recover just as quickly as those who take a longer course. That doesn't mean that all the symptoms will be gone by 5 days, but once the antibiotics have kicked in and got the infection under control, the idea is that the symptoms will continue to improve at just the same rate whether you're continuing to take antibiotics or not. And that's important because taking less antibiotics is likely to be less harmful for your body and the healthy bacteria that help to keep your body healthy, and less likely to cause antibiotic resistance. So that's what the research evidence seems to suggest, and current guidelines are already recommending a 5 to 7 day course of antibiotics in primary care. The trouble is there have not been studies using the antibiotic that we most commonly use in this country, flucloxacillin, in a primary care setting. And that's why we want to do this study, to test whether 5 days is just as good as 7 days of flucloxacillin in the primary care setting. So what will happen if you decide to take part in the study? Well, you'd be prescribed a normal NHS prescription for flucloxacillin capsules to take for the first 5 days. And then you'll be sent a pack which will contain capsules to take for an additional 2 days. Some people will be given an additional 2 days of antibiotics, and some people will be given a placebo capsule, what are sometimes called sugar pills. Whether you get the antibiotic or placebo will be decided completely by chance, just like flipping a coin, and you'll have an equal chance of getting the antibiotic or the placebo. The antibiotic and the placebo capsules will look the same, so you won't know which ones you'll be taking. But if your infection is getting worse or you're worried about your symptoms, you'll still be able to see your healthcare professional and get other treatment if needed. To know the effects of the treatment, we're going to ask people in the study to answer a few brief questions about their symptoms every day for 14 days. And that can be done either using a simple online form or using a paper questionnaire. And then a few more questions 1 and 2 weeks after that. There's more information about the study on the website and in the information sheets. I've only told you a brief bit about the study. So if you're interested in taking part, please do have a look at those information leaflets and discuss it with your healthcare professional. Thank you very much for listening, and take care.